welcome back. And to start with our first segment for today, President Abdel Fattah el-Sisi actually has called for strengthening all financial efforts and also to support the COVID-19 pandemic repercussions on all fields. And on the other hand, the Minister of Health, Dr. Hala Zaid, also held a meeting with all the ministry officials to discuss all the process, the vaccination process to take place or is due to take place next week. Over the phone, we have with us Dr. Muhammad Awad, and of course, he is the Presidential Advisor for Healthcare and Prevention. Hello.
Hello, how are you?
Good morning, Doctor. How are you? And thank you very much for joining us. First of all, talking about the efforts exerted by the government to contain the pandemic COVID-19.
Thank you for thank you very much. Good morning. Definitely, we were expecting that there is some increase in the prevalence of the disease during this period. So that now we are increasing the number of available beds for the patients, either for screening or detection of the cases, and the cases needs admission to the hospitals. They are ready for accepting the patients with different facilities all over the country. Also, equipments, disposables, and medications. And auction also, now there is increase in the production to cover the increase and the needs for the services during this period.
Doctor, talking about the second wave of the coronavirus pandemic, and of course it is expected to have modification of the virus as well. So if we're going to talk about this in particular and about how we are going to work on this part and our adopted policies to contain the second wave, if we're talking, for example, about the vaccination, which is due to take place next week.
The first point that from the scientific and medical point of view, the mutation of the viruses or the change in the genetic composition of any virus is known from the medical point of view. Even for the seasonal influenza virus, we have modification in the genes or subgenes of or substrains of the viruses. That's why every year we have a change in the composition of the routine seasonal vaccine every year. So that now, since since we know that there is a new virus, which is the new coronavirus or novel coronavirus 19, it's now 1 year, so that we expected that there is some changes in the genetic composition of the virus, so that it is not new or not astonishing that we have some new strains discovered in some countries, for example, in UK and South Africa, so that this modification is well known. It is sort of behavior of many viruses, so that this new wave maybe there is some changes in the genetic composition of the coronavirus. This new wave or increase in the wave where it was expected since last September, because we know that the prevalence of the viral infection usually increases during the winter months.
Right. What about the vaccines that we are using right now and our preparations for the vaccination process, which is due next week, and how it is going to work for the modification of the virus as well?
Up to now, the scientific researchers say that there is this vaccine, any vaccine of the new vaccines, which was now will be available next week, or any other vaccines, which will be supplied by Gavi, which is the Global Alliance for the viruses assessment and also for distribution of the vaccines all over the world. no definite data now indicating that this vaccine will not affect the new strains, and even if these new strains maybe could be resistant to the vaccine, but definitely the vaccine will cover the most common and the most prevalent strains of vaccines of the viruses which is already present all over the world now.
Doctor, so far, what about the medical observation for those or for the volunteers who have taken the vaccines already?
Excuse me?
Talking about the medical observations when it comes to the volunteers who have taken the vaccine.
Yes, the vaccine, the main value of any vaccine, if anybody takes the vaccines during the next few weeks, maybe 15 days after vaccination, there is development of antibodies against the virus in the body. So that after analysis of the data of the vaccinated persons, already there is antibodies against the vaccine. But for how long the vaccine will protect against the infection or the virulence of the disease or the complication, still it is under studies. But now the main goal, if you give anybody the vaccine, your expectation that you have some antibodies against the virus. But this vaccine, more or less similar or identical with influenza seasonal vaccine, it protects against, there is some protection against infection, but the most important value of the vaccine, this type of vaccine, that it will protect against the complications.
Doctor, according to a statement by Minister of Health, Dr. Hala Zayed, talking about that Egypt has reserved doses of the vaccine that has been developed by Pfizer. So could you tell us more about this, as it's going to cover 20%?
The vaccines is now under, it's already tried in Egypt and tried in many countries. But now there is a scientific committee which analyze the data which is observed after the vaccination of the persons for follow-up, for estimation, and for also publication of the experiences. And also already we have this scientific committee. Usually they analyze the data from different parts of the world to take the advantage of the most available, most effective, most efficient types of vaccine.
Doctor, I will ask you about something that's really very common among people or people who are thinking of the vaccine, that it doesn't mean that they are going to take the vaccine, that you remove the mask and you just move around as if there is nothing taking place. So what is your main advice or the precautionary measures, even after taking the vaccines, especially during this period of time?
There is no important protective mechanism up till now, except the precautions and the recommendations for the masks, for the other preventive measures, for the distance, for the sterilization, for washing hands. Still, the other protective mechanisms are very important. And for me as a physician, and I am a pulmonary physician, the protective measures are still the most important measures to protect against the infection.
So what is, when we come to conclude all what is going on and the people who are also scared of the second wave or the modification of the virus, as we all heard and understood, for example, in Britain, that it has the same symptoms, but it is all about the how it spread rapidly. So do we have anything in this respect as well?
Yes, still, as I told you, the protective mechanisms and the keeping the social distance, and if there is no importance for any, if no vital importance to for the persons to go into public areas with heavy people. So that I think still for the protection and for the data which is published now about the virulence of the virus is still the protective measures are still the priority.
Right, and of course taking into consideration children as well, because now many people are very much worried about the children and about how to protect them.
Yes, we must protect the children, and but because there is some records now from UK and from South Africa that this more virulent strain may be spreads with the children and may lead to some complications in children. And children, if they are not infected, if they are not diseased, they can be also spread the disease to other people in their homes.
Right. Of course, always a pleasure having you with us, Dr. Muhammad Awad Tajuddin, Presidential Advisor for Healthcare and Prevention. Thank you very much for your advice, and always a pleasure having you with us on the program. Right, still we have more to bring you on the breakfast show, but first moving on to a quick break, then we'll be back with more on the show.